Many community services face special challenges during the COVID-19 crisis, and one such is Child Advocates of Fort Bend.
We have responded by doing a number of things. First is we are following all of the CDC guidelines. We are working remotely. Many of the staff is working remotely, but continuing to connect with children through Zoom and other platforms so that we're able to visit these children on a regular basis in their foster homes or wherever they're placed. We also are working with our courts. Our courts are now not operating in person. They also are using Zoom. And so we actually attend court via Zoom so that the cases continue to progress and we don't, stall in any of the progress that has been made with all of these children's placements and their move to permanency and safety. In our Children's Advocacy Center, we are working on a kind of a rotating schedule. So we are considered essential workers by the governor. And so we cannot suspend any services. We must perform all of the services for children. And we work in conjunction and collaboration with law enforcement and CPS, who are also considered essential workers. So it's critical that we are able to continue doing our jobs. And so what we do is we will have staff assigned by day on a schedule. So we have limited the number of staff members in the building at any one time, but we limit the number of children at any one time. So we try to schedule so that there's only one child and one family in our building. And then we, of course, practice social distancing and wearing masks and disinfecting the areas. But it's critical that, even when times are, very focused on a pandemic, that we don't forget the children. Oftentimes, children are the ones who suffer most. For adults, it's obviously a difficult time, and adults are going through quite a bit of, uncertainty and ambiguity. But for children, this is going to have probably short-term effects, but it may have long-term effects for the rest of their lives. They will never forget that they were part of a pandemic. And we do not want any child to go without immediate attention if they are certainly in a dangerous situation. One of the things that is so critical and that we're so focused on right now is telling the community and building awareness. Because it's that neighbor, or it's that, maybe a child is on, FaceTiming someone and someone on the other end sees something that doesn't look right. It's being alert and aware and being able to say, I think there's a problem here. I need to make a report. And so we're getting out on social media and through other media, alerting the community that it is their really responsibility to take care of children and to make sure that no child falls through the cracks.
For Stafford CSI, this is Randall Williams.